It is just setting up, and we will be live in about 10 seconds.
Hello, everyone. I'm Jen Rumbolsky from the La Crosse County Health Department, and I'm coming to you today to talk with you about some risks in the community that I want to make sure you are aware of. So we have all along said to you that if we felt like there were community risks related to certain locations in the community that we needed to inform you about, that we would do that. So that's the point of today's briefing, is to share with you what those risks are, what they mean, and what you can do about those risks. So first of all, we do have, as you know, we have had a lot of cases coming in over the last week and a half. Today's cases, we've had 5 that have come in. We had 10 come in yesterday. It's been very, very busy in our department following up on cases and their contacts. At the present moment, we have a total of 130 cases, lab confirmed cases of COVID-19. And because of the speed in which that number has grown, 65 of those 130 cases are active cases that we have separated out across our case investigation team. And that's a lot at one time. So I do just want to share with you, one of the things that we try to do is spread cases out over time so that it doesn't overwhelm any of the response mechanisms, to include the public health response with cases and contact tracing, as well as, if there is severe disease, the healthcare system, so that we don't have a lot of folks at any given time who really need to have that level of care in a healthcare system. So what we're seeing right now is some of that, the public health side of that response arm being inundated with cases because they have grown so rapidly. So I think that really comes into play with my bringing to you today a list of 7 businesses in our community at which we've had individuals who have been lab confirmed positive cases. And again, the 7 establishments I'm going to name today and the dates of which folks were at those establishments, we're looking at, and I can talk more about this later, we have a public notification plan or process that we follow. And one of the key aspects is how many cases in what locations, over a certain time period, was there close contact that happened. So I can talk more about that, but I just want you to understand that the establishments that we share with you are really because we feel there is a risk for those that may have been in those establishments on those dates, that you need to be monitoring yourself for symptoms if you were there. So the known risk of exposure at the following establishments, and I will list them off along with the dates in which we believe the exposures may have occurred. So the first establishment is the Blue Moon in Onalaska, and that the dates of potential exposure there were June 6th and June 7th. The Library, which is a bar in La Crosse, the date is June 6th. Legends and the Twisted Moose in La Crosse, that was June 7th. Pettibone Beach in La Crosse, that was June 5th. The Crow in La Crosse was on June 7th. Brothers in La Crosse on June 6th. And Broncos in La Crosse on June 6th. So I want to be really clear that naming these establishments is not anything other than identifying a risk where we cannot determine who may have been exposed. So this is all about decreasing risk. It is not about blame or shame. So I want to make that very clear. So we have connected with these establishments. They are aware that someone has been at their establishment at the time in which they were in their infectious period. We are working with them. Some of them have taken some precautions, and I think there are opportunities for improvement, and we're working with those establishments to try to increase the precautions and decrease the risk. In addition, I think it's important to note that we feel that, if you know anything about economics, it is about supply and demand. So these businesses have been open, serving the public, but people come to these locations. And again, we've been saying that anytime you come to a location, whether it's a grocery store, a gas station, a shopping mall, a bar or a restaurant, it doesn't really matter what type of facility, there is some level of risk present at all of these locations. And as we grow in case numbers, and those cases have contacts, and those contacts may become symptomatic, and then they have contacts, I mean, that is how this virus works. And it really comes down to, you have the opportunity to decrease your risk when you are leaving your home. So there is always risk outside of your home. And in order to decrease that risk, you have to think about, especially if you're a patron or visiting an establishment, if you want to go out to eat, if you want to go to a bar, if you want to go to a grocery store, any of those kinds of locations, you should assess what's happening around you and think about what the establishment is doing to decrease risk. And if you are not comfortable with the level of safety precautions that are being taken, for example, if you see that individuals in that establishment are not wearing fabric face coverings, are not physical distancing, have not set tables 6 feet apart, that there are, these sort of tried and true tools that we know, maybe somebody is there that appears to be ill, you have the choice to leave the establishment and not be present in that environment. So I just want to put some power back into your own hands as you think about where you're going, that you can make that assessment and determine the level of risk, and you can make that choice not to be in those locations. I think the most important things are, again, staying home if you're ill. And I reiterate that COVID-19 can appear very mild, and that can be a minor headache, a slight cough. You wouldn't even think it's really anything. I think that's what's challenging about this virus, is it can be very mild, and you have to take those mild symptoms seriously, especially now, knowing that the level of viral activity in our community is increasing, and we just need to be really keenly aware of that. I also want to address here that I think there's been, we've seen some trends in the age group of 20 to 29-year-olds who, have had cases. And please recognize that judgments in this regard are really not helpful at this time. Think about that there are individuals in that age group that may frequent locations, but they also are frontline workers. They are they are important parts of our healthcare system, our long-term care facilities, our economy, really. So we do need to remember that we're all in this together, and we have to work together to decrease risk. So I just want to point that out, that judgment and stigma is really not going to help us win this war against this virus. My last point is really that just because I list these 7 establishments doesn't mean that the takeaway here is for you to not be in these seven establishments. I think the takeaway is that anytime someone who is a lab confirmed case is in a location, it can increase risk. And we don't always, I think that, just because these 7 are named today doesn't mean we don't know of some risks at other establishments that don't raise themselves up to the level of public notification, nor does it mean that there isn't risk anywhere you go outside of your home. So I think these specific 7, though, are important to share because we believe that there are individuals who may have been in those locations on those dates that may have been exposed, and we cannot contact them because we don't know who they are. So I think that's the purpose of a public notification, is anytime we become aware of a situation then that we can't identify and be able to reach those contacts that may have been in close contact, that's when it raises to the level of a public notice. And I think the fact that we have not had one for a long time, and now we have 7, does say something about the volume of growth of this virus in a very short time frame. And remember, these locations were, these cases were there on June 5th, 6th, and 7th, and we're on June 15th. So we have this natural lag time between when those cases actually get tested and identified, the look back period to determine up to 2 days prior to their symptom onset or their test date is when we determine they were infectious. We don't know that right away. It can be a week or a week and a half, which can sometimes put us out of the 14-day window for when individuals might have been exposed and developed symptoms. So the most important takeaway is that this virus is currently taking hold in our community, and we have to work together. Do not go out if you are sick. Recognize the symptoms can be very minor. Identify the level of precautions that are being taken at establishments that you choose to be a patron or visitor at. Make choices based upon what you know about the virus to protect yourself and others. And it really comes down to wearing a fabric face covering when you're out and about, physical distancing, and not being out when you're sick. And I think that what has happened in our community over the last couple of weeks can be explained by those 3 things not being taken seriously. And we've had situations where there are groups of people that are meeting, might be in a place of employment, like a workplace setting. They're having a meeting, someone doesn't know that they're sick. They later find out they are. Everyone at that meeting is exposed. Please look at the Compass grid, the Compass recommendation table on the Cooley COVID-19 Compass website, and use that to help you make good choices. If we are in an indoor setting that is less than 15 people with a fabric face covering and physical distancing, I can't say it enough that if we were simply doing those things, we really would have many, many less cases than we do right now. So just know that the level of risk is definitely up in our community. We have to make good choices. We know what we need to do. And I think that what right now with those 7 establishments, if you were in those establishments on those dates, we will have a form for you that is on our website and will be on social media on our Facebook page. We would ask that you complete that so that we know that you may have been in an establishment that I listed during the dates that I listed, and we can contact you to talk about your level of risk and determine what your actions need to be next. So the last thing I will just say before I take questions is to just ask that you be patient with our team. We are getting a lot of phone calls right now. We're getting a lot of emails, and we're grateful for that. We have a very good established connection with our community, and I know many people have questions. We are prioritizing that workload to make sure that we are getting at cases and contacts, and then communications through our media partners to make sure that you know everything you need to know as quickly as we can get it to you. So just know that we're getting all of your emails and phone calls. We appreciate them, but we are prioritizing them, and we will get back to you, but we ask for your patience so that we can focus on the most important work to decrease the risk in our community. So with that, I will take questions from our media partners.
Hi, Jen. This is Andrea Elbers with WXW. Can you hear me?
If you could speak up a little bit, it's pretty quiet.
Okay, gonna talk as loud as I can here. Governors of Wisconsin and Minnesota have both said if you participated in any protest, you should go and be tested. If people decide to follow that advice, can they be tested locally without having symptoms? And do you agree with that guidance from the governors?
So that's a tough question, Andrea, because individuals, so right now, based upon the current connections we've had with cases in our community, so lab confirmed cases, we only at this point know about one individual who is a lab confirmed case who had been at a protest. So it's not like the vast majority of our cases right now have been at a protest. I do worry about, even though we currently have capacity for testing, we are stressing that capacity because of other things that are happening. If there's one case at a long-term care facility or an assisted living facility, many times because the severity of the risk there in a facility in a congregate setting is so high, we need to test those folks, the residents and the staff. There are other situations where we will recommend individuals who are considered close contacts to be tested if they are not symptomatic, but it is not something that we can do across the board for everyone at this point for a couple of reasons. One, because the level of capacity of testing is not where anyone who wants it can get it. And two, it still has to be based on risk. And we need to make sure that there's an organized process for that to occur. So I don't know that I would say that anyone who has been at a protest should get tested. The other thing to consider here is that even when you've been notified by our office that you are a close contact, so that is within 6 feet for at least 15 minutes. It's not just being in the same area. So when you meet that case definition of a close contact and we contact you, even if you go to get tested, you still need to be in quarantine or isolation for the full 14 days because the test result is not a clearance test. It does not say, nope, and during this entire quarantine timeframe, you aren't going to have COVID-19. So we have the situation where if you get tested too early in your infectious period, we've seen it happen before where someone who is at the end of their quarantine could test positive, but early on they may not. So it can give a false sense of security and cause people to not believe that they need to stay in quarantine or isolation. Now, that isn't the reason that we don't support the testing, but I do think it is an important consideration in terms of making sure that we are, again, using the resources available to us in the most efficient way possible. That was a long answer to your question, Andrea. Sorry about that, but I know that a lot of people think about protests and the level of risk there, and it really just comes back to close contacts. And if you're a close contact based upon that definition and you have symptoms, we definitely recommend testing. There are some who are close contacts who don't have symptoms that we will work to get you tested. Beyond that, there are no across the board recommendations.
Hey Jen, Justin with WKBT. I was wondering if you might be able to give us maybe a little bit more details on some of these people who were tested positive from these establishments. I realize that might be kind of difficult, especially if you don't have the numbers in front of you, but I was just kind of curious on if there's more males or women or kind of those kind of details.
Yeah, Justin, you know that I always like to give you as much information as I can. Unfortunately, with 65 open cases right now, active cases, and a number of outbreaks that are happening, the level of viral activity, I just don't know that for sure. I would have to sit down and really look for that answer specifically. And I think that the most important point is to just recognize that we have a lot of viral activity going on right now. And we have to do something different in order to decrease that viral activity. We need to really take this virus seriously, and we need to take the precautions we've talked about. We need to, keep our meetings inside for less than 15 people. We need to physical distance, and we need to wear fabric face coverings. We should not go out in public and see the vast majority of people not in face coverings. We are not going to get control of this virus if we don't use every tool available to us.
Hey Jen, I know the La Crosse Police Department announced today that an officer has tested positive. Can you speak at all on that?
Yeah, so I mean, this is part of the reason why we look at testing police, fire, and EMS to make sure that our first responder agencies are safe and that they know their status at any given time. So yes, with this particular officer, we do know that that he had symptoms and was tested and went through all the right channels, and they're taking every precaution they can. And I guess what I would say is that I think it's important to understand and appreciate that they have been really transparent with that information. I said that about the why as well. I think that's so important for them to share. But I would just reiterate that that doesn't mean that the police department is not safe. If you need the police department, they're there for a reason, and they are taking every precaution possible to make sure that they are still safe to respond for our community. So I just want to sort of calm any fears that folks may have about, you know, whatever that might look like to you. That one case, we know about it, we know who the contacts are, we're working on that, and there are precautions being put in place to assure that we reduce all potential as much as possible to the spread beyond those contacts at present, and that they are safe to contact to reach out to the police department for anything you normally would.
Hi, Jen, Andrea here again. You said capacity for testing is being stressed right now. Can you tell us about how serious these 65 active cases are right now, and what you know about any current stresses on the healthcare system as it relates to things like open beds and ventilators and any new hospitalizations?
Yep, so thankfully, Andrea, this level of stress on the healthcare system right now is not coming from severe disease where they are, you know, their beds are filling up and they have people who need to be in the hospital. We only know of 2 cases right now of our total active cases that are in the hospital, and one of them, though we list them for COVID, we have an asterisk that indicates that person is actually in the hospital for something other than COVID, but they are a case. So we list them as such. So thankfully, we don't have a lot of severe disease. That's wonderful. We don't want to see people with severe disease, but we never know that. It just depends upon who gets it, and it can really change quickly. And I would just say again, our primary goal is to stop the spread so people don't get COVID-19 in the first place. Then the next goal is to contact cases and reach contacts to make sure the spread reduces and doesn't go to a number of more exponential folks, which is happening right now. And then the last effort really is to make sure that we can be available for severe disease. So I'm grateful we're not to that point, but I will just reiterate that we are definitely seeing a lot more virus activity, and that is very concerning to me.
Hey Jen, Justin again with WKBT. With the Cooley Compass, are you considering moving us from high risk to severe risk? And I guess if not, what would be the threshold for that decision?
So I don't make that move from high risk to severe risk. That is dictated by the data. And will I be surprised if we move to red this week? No, I will not. That data updates on Wednesdays. And remember, it takes into account things like our case numbers and the how quickly they're increasing. So we know epidemiology is likely to be in red. That's the first bucket. The second bucket is the healthcare realm. And I think the healthcare realm is okay. The third bucket is the public health capacity realm. And that is the data bucket that really looks at the ability to get at all of the cases and contacts in a certain time frame, as well as personal protective equipment needs, and whether or not those folks can get the needs filled when they make those requests, things like that. So that is the area last week when we updated the compass that was very close to being red. So again, I wouldn't be surprised if we move into red. I think the key question is, what does that mean for our community? And it's exactly what I'm currently saying, is that the level of viral activity in our community is concerning, and it will only grow if we do not do a better job of taking precautions. If we continue to go to bars, restaurants, grocery stores, shopping centers, wherever we want to go without a fabric face covering on, without physical distancing, if we have symptoms, even if we think they're mild, we are going to have continued spread at an exponential rate in our community.
Hey, Jen, we're getting a question from Facebook. It says, this is the first time you've listed specific businesses where people have been put at risk. Have there been places in the past where you know people may have been put at risk? And if so, why did you not release that information then?
Yeah, good question. So if you recall, and this was a while back, we have not had to do a public notification for quite some time. A while back, there was a funeral, that there was a case at a funeral, and we did list that that church where the funeral took place. So that has happened before. The person, though, that's asking the question is right, that it's been quite a long time since the last public notification. And I think that that is a question we've been getting a lot. And I just want to help folks understand that we look at, it's sort of like in my head, I'm a visual person. So it's sort of like recreating a scene. If you're a police officer and you're trying to determine what was the cause of a car crash, right? So we get information in and we pull that from disease investigators, those that are talking to the cases, our staff who talk to the businesses, and we pull all of that information together and we recreate the scene at any given establishment where a case may have been in that establishment. And we want to know, like, was the case someone who was visiting? Where were they sitting? How close were they to others? Were they just at a table by themselves or with their household contacts? Was it a waitress who was serving people routinely? Can we identify who was really in close contact, again, within 6 feet for at least 15 minutes over the course of any given amount of time? So we ask a lot of questions to put that scene together, and we've been able to very successfully do that up until this point. And we've been able to identify those who may have been in close contact, and we've been able to contact those folks and give them guidance and advice about what to do next. It's the situation where we cannot determine all of those individuals who may have been in close contact, and that's when we need to do a public notification. So that process has not changed from the beginning. But I think it is, people ask questions because it's been a long time since we've had to do that. There's been a really fast increase of viral activity. Lots of people out and about at lots of different locations in the community. And that increases the level of risk and makes it much more difficult for us to do that quality process of figuring out who has really been in close contact at any given establishment when a case is made, when we can determine a case has been in a certain location.
Jen, this is Andrea from WSW. Just to follow up on that, I know you said that the contact tracers are kind of inundated right now with these new cases, but of the 7 locations that you just identified as risk areas for exposure on certain dates, some of those, of course, are bars and restaurants. Do we know if the majority of the people who tested positive were employees, or were they there as patrons or guests?
Yeah, so I think it's a mixture, Andrea. I know that there have been some employees. I know that there have been some folks that were visiting. I think it's a mix. And so again, it doesn't necessarily, it does somewhat matter because, right, if it's an employee who is at an establishment, then the opportunity for that person to have close contact with others in the establishment during the time that they're there does increase that risk to those that are in the establishment, as opposed to someone who is visiting and eating by themselves at a table that might be 6 feet away. It's probably just the waitress who is the close contact for that person. So I think while it does matter, it has been a mixture, and we do take that into account, but I don't have the breakdown for each of these establishments that I listed. I think it's really about those pieces come into play when we kind of play out that scene to determine the level of risk and the possibility of close contacts, and if we cannot determine who all of those folks were.
Do we have any other questions for Jen today from the media? Looks like we do.
Hi, Jen. Andrea again. One final question for me. Do you think that young people may be less concerned about social distancing guidelines or even about being tested, especially if they might be asymptomatic? And if so, what are you doing to try and communicate with that age group?
Yeah, thanks, Andrea. You know, is it possible that young people don't think that this is as much of a risk for them? Sure, but I think there's a lot of people in our communities, not just La Crosse County. I see it a lot. I think there's a lot of people that don't take this virus seriously. And thankfully, we have not had a lot of severe disease. We have not had a lot of deaths. But my job is to prevent that from happening and to try to get that across the best I can, because I don't want to be in that spot and look back and say, we could have done more. I want to be able to empower all of us now to understand that there are tools that we are not using that can decrease the spread of this virus. I can't force individuals to recognize how serious this situation is. I think as cases grow, that naturally happens. Hopefully it does not take severe disease and death in our community to get that message across. I think that it matters that we are using all of the tools available to us. We have to be physical distancing. We have to be wearing our fabric face coverings when we're out and about. There are many people who choose not to do that for whatever reason. And I think a lot of it comes back to not appreciating the risk levels, and not just for themselves, but for other individuals as well. We are part of a community. We are not just an individual living in a silo. We are part of a community, and we can impact each other in positive and in negative ways. And to your question specifically about messaging to various populations, yes, we do that. It is tougher, I will be honest, to get at the 20 to 29 age group. They are a harder group to reach. They are definitely more connected on social media, and we have found ways to make those linkages. So if our media partners have abilities to get to those folks, we are grateful for those connections, but it is not just that age group. We are all able to take additional precautions, and now is the time to be doing that, because if this virus continues to grow exponentially as it currently is, we will become overwhelmed. I have seen across the country locations that can no longer do contact tracing. Now I can tell you, whatever I can do, I will not allow us to get to that point. I will pull whatever resources possible to continue that really strong case follow-up and contact tracing process, because it is such a critical tool. But I need help from the community. I need you all to take those recommendations seriously and to implement them, because without that, the cases will continue to grow. And again, one case can turn into, 2, 3, 4 cases within their contact group, which can cause an exposure at a long-term care facility, or a daycare, or an establishment. I think I need to get across to the community that risk will continue to increase unless we're using every tool available to us.
And Jen, can I just get you to reiterate that if somebody was at one of these establishments during the dates you're saying, that they don't need to panic or that it means they have COVID, but just that they should be monitoring their symptoms maybe a little closer?
Yeah, thanks, Haley, for bringing that up. I would say if you were in one of these locations on these dates that we mentioned, we want you to reach out to us. We want you to fill out the Google form that we're providing. That'll be on our website, on our social media sites. We want you to fill that out so that we know about you and can reach out and connect with you. What we're going to tell you is, we're going to talk to you about your level of risk. We're going to learn more from you about where you were, when you were there, how long you were there, what you remember. We're going to ask you questions about symptoms to see if you have anything currently going on. And then we're going to advise you and help you understand what to do next. You're right, it is about monitoring symptoms. But again, I think that connection with our team is really important. So please feel free. We want you to fill out the Google form. That's the whole point of the public notification process, is so that we can establish that connection that we don't currently have because we don't know who was in those establishments on those dates. So if we do know that, then we can close the loop and make sure that we can monitor that piece and assure that there isn't continued spread. And you're right, Haley, they do not need to panic. This is simply a conversation about help education and helping the individual to understand risk level and what to watch for and what precautions to take to assure that they don't spread it to others.
Any other questions for Jen today? Not seeing any.
Well, thank you so much. And just final word is the precautions that you take now as a business owner, as someone who visits a place of business or an establishment, as someone who is out and about in the community, the precautions that you choose to take can have a significantly positive impact on our community and can significantly decrease the risk of the continued spread of COVID-19. So please do that. Please look at the COMPASS recommendation table. Familiarize yourself with the risks and how to reduce those and take those precautions. Stay home if you're sick, physical distance, wear your fabric face covering, and wash your hands frequently. And we will make an impact against this virus and its spread. Thank you so much.